唔夾，唔夾，唔重。我仲叫佢順利。
你叫佢後門入啊！Good afternoon, everyone. Today we would like to talk about a disease about the endocrine system, which is hyperthyroidism. And hyperthyroidism is a type of thyroid disorder. It is a state of excessive thyroid hormone, and it is also called thyroidopsychosis. There are two types of hyperthyroidism. The primary type is the intrinsic cause, such as the Graves' disease, and the secondary is the extrinsic cause, which is the thyroid-stimulating hormone secreting pituitary gland tumor.
For the epidemiology in Hong Kong, the prevalence of the hyperthyroidism is 3.93%, and it is defined by the T4 is larger than 50 nanomole per liter. And the peak occurrence of the hyperthyroidism is 20 to 40 years old, and is frequently in women than men. And the reason we choose this topic is because this topic is closely related to our future career, radiation therapy, because hyperthyroidism is a precursor of the thyroid cancer, so we should have a better understanding of this. And second, it is closely related to us, since the peak occurrence is 20 to 40 years old, and it is close to our age group. And third, we all think that the mechanism behind is interesting. For example, the thyroid hormone negative feedback, and we will further discuss this in the future slides.
So when we are talking about the etiology, which is the cause of hyperthyroidism, it has distributed into three groups, including the common, rare, and very rare. For the most common cause of the hyperthyroidism, which is the Graves' disease, is a kind of autoimmune disorder, which will cause the thyroid gland to grow, and in this situation, it will increase the secretion of thyroid hormone. The signs and symptoms of Graves' disease include bulging eye, anxiety, low heat tolerance, weight loss with increased appetite, etc. The other cause for hyperthyroidism, which is very common in elderly, is the toxic nodular goiter. Patients will suffering the multiple goiter, but in this situation, they will not have any symptoms from the Graves' disease. Thyroiditis is another common cause for hyperthyroidism, which means the inflammation of thyroid gland. This may be due to the viral infection, medicines, or even after pregnancy. Taking too much thyroid hormone is another common cause for hyperthyroidism. In what situation patients will having the overintake of iodine, which may be due to the self-medication or the drugs. For the self-medication, patients who intake too much iodine supplements or some energy boosting preparations will increase. Others, for the drugs, like amiodarone, which is used to treat ventricular tachycardia or fibrillations. Also, lithium, which is a drug used to treat the depressive disorder, will also can be a kind of common cause for hyperthyroidism. For some rare and very rare etiology, some malignant growth in the thyroid gland, pituitary gland, or even in the ovary and testes will increase the risk of suffering hyperthyroidism. Besides malignant growth, some benign condition like solitary thyroid nodule, which is the toxic adenoma and palpable, is also another cause for hyperthyroidism. Last but not least, in excess consumption of iodine-containing food like seafood, seaweed, meals, etc., will be the other rare cause of hyperthyroidism.
And next we are going to talk about pathophysiology of hyperthyroidism. But before that, we need to know about the physiology of hyperthyroid gland. And thyroid gland is formed by many follicles. Follicle is a sac-like structure, and inside each follicle we have a lot of colloid. It is a secretory substance, and it contains thyroid globulin. Thyroid gland is efficiency in the use of iodine. The daily absorption for normal human are 15 milligram. And the function of thyroid gland is to remove iodine from the blood and store for future use. Iodine is pumped from the blood circulation to the follicular cells against the concentration gradient. And iodine in the thyroid gland is 40 times more than that in the circulation. And thyroid hormone are including triiodothyronine T3 and thyroxine T4. They are formed by the iodination of the thyroid globulin in colloid, and they are secreted into the blood circulation. Most of them are the T4, and they bind with the thyroxine binding globulin and other plasma protein for transporting in the blood. And free thyroid hormone that will enter the cells and trigger the feedback mechanism. The function of the thyroid hormone are including increase the metabolic rate, cardiovascular function, respiratory function, gastrointestinal function, and also the neuromuscular function. And they also contributed to the mental development and the sexual maturity. Thyroid function is controlled by the hypothalamic pituitary thyroid feedback system, and hypothalamus will secrete thyrotropin releasing hormone TRH, and TRH will enter the anterior pituitary gland, and the pituitary gland will secrete the thyroid releasing hormone TSH. TSH will increase the overall activities of thyroid gland and increase the thyroid globulin breakdown, and also increase the secretion of the thyroid hormone into the blood. And as we said before, the free thyroid hormone will enter the cells and go to the trigger the feedback mechanism. Change in the level of thyroid hormone will inhibit or promote the production of TRH or TSH.
After understanding the normal mechanism of the thyroid gland, here is the mechanism of the hyperthyroidism. When there is low level of thyroid hormone in the blood, it will be detected by the hypothalamus. The hypothalamus will secrete the thyroid releasing hormone. This will stimulate the pituitary to secrete thyroid stimulating hormone. Increased level of TSH will stimulate the thyroid to produce more T3 and T4. Excessive amount of thyroid hormone secretion will lead to the enlargement of thyroid gland. Goiter refers to the enlargement of the thyroid gland. Let me talk about the mechanism of Graves' disease also. T lymphocytes are sensitive to the thyroid antigens and will stimulate the B cells to produce immunoglobulin G antibodies. Immunoglobulin G antibodies will bind to the cell membrane TSH receptor. This will stimulate the synthesis and secretion of thyroid hormone. These antibodies are called thyroid-stimulating antibodies. When there is excessive secretion of thyroid hormone, this will cause the enlargement of thyroid gland, and this is called the Graves' disease.
And you may ask, how can we know a patient is suffering from hyperthyroidism? And here is some potential signs and symptoms. Patient may suffer from tachycardia, systolic hypertension with wild pulse pressure, hand tremor, muscle weakness, weight loss despite increased appetite, warm, moist, smooth skin, fever, excessive sweating, heat intolerance, and patient will have eyelid lag, stare, bulging eyes, and his or her neck may have enlargement or mass, pain, dysphagia. And patient may feel nervous, irritable, and fatigue. And some of them will have shortness of breath. And especially for the female patient, she will have the reduce in menstrual flow.
I will talk about the prevention method and therapeutic method. For the primary prevention, we can prevent of tobacco smoking, as tobacco smoking will increase the risk both of multinodular goiter and Graves' disease. For the secondary prevention, people can participate in screening programs such as monitor the serum level of TSH, calcium, and calcitonin. Graves' disease is a genetic disease that cannot prevent. For the therapeutic measure, patients can do surgery, thyroidectomy, can be permanently cured by surgical removal of most of the thyroid gland. Also, patients can undergo single oral dose of radioactive iodine 131. It can be in capsule or liquid form. It is use of radiation to ablate or destroy the excess secreting thyroid hormone. The radioactive iodine is absorbed by the thyroid gland, as thyroid gland absorb iodine to produce thyroid hormone. Anti-thyroid drug can be one of the therapeutic measures. It can directly reduce thyroid hormone level, such as methamphetamine and propylthiouracil. Beta blocker. It can treat the symptoms associated with hyperthyroidism, such as tremor, palpitation, anxiety, and heat intolerance, but cannot treat the hyperthyroidism directly. Selenium supplementation. It is a new therapeutic approach for autoimmune thyroid disease, which is Graves' disease. Supplementation with antioxidants in the treatment of Graves' disease is justified, particularly those containing selenium. To conclude, hyperthyroidism is a state of excessive thyroid hormone in the thyroid gland. It leads to an increase in metabolism and the alteration in body function similar to those produced by enhanced sympathetic nervous system. Graves' disease is the common cause of hyperthyroidism. The excess thyroid hormone of Graves' disease is stimulated by the thyroid-stimulating antibody. Surgery, radioactive iodine, and anti-thyroid drugs are the common treatment for this thyroid disorder. And here is our reference. This is the end of our presentation. Thank you.